All right, so let's do some education on different weight management medications that are available commercially, basically for everybody who's eligible for. So I'm going to talk a little bit about Contrave, which a lot of people don't really know about, but Contrave essentially is a combination of two medications. It has bupropion and it's got naltrexone. Bupropion, it's available in the market typically for the management of things like generalized anxiety disorder, but it's also available for those who, let's say, want to quit smoking and also drinking. And the reason being is that it works in the craving center of the brain. So that same concept was applied in the terms of weight management, and so it works in that craving center of the brain to reduce cravings, thereby helping with weight loss. Naltrexone essentially blocks the other side, but it also has to do with like the craving center of the brain. And so both together help deal. I use it primarily more for anxiety induced eating behaviors. Also I have had patients in the past who struggle with their weight because of drinking, and so they can't stop drinking because they associate drinking maybe to like de-stress from work or life in general, and so they can't stop it and they need help, and then they also want to lose weight. So that's a really good medication to use in that sense. So that's why I've used it. Most common side effects, I feel like with all medications for weight management, constipation, diarrhea always go hand in hand. Now this one being like in more of the area of like mental health and stuff like that. This one's one of the ones that once you start, you can't just stop it. You have to taper off. And so it does have a concern for people who have had like suicidal ideations in the past. I typically don't recommend it because it is a black box warning for bupropion itself. But I have never had any issues with any patients, and it's used pretty commonly. So I didn't think it's a wide concern, but usually your provider should assess for that. So side effects, again, so it says suicidal ideations is common, or it's not common, but it's one of the ones. And that's pretty much it, really. Usually it's for the naltrexone is a very low dose of it, so there's really no side effects pertaining to the naltrexone per se. Most of the side effects come with the bupropion, including like vivid dreams, and nausea can be pretty significant as well. But that's pretty much, it's a very effective medication, and I just wanted to do a little bit more education on that medication per se, because right now it's not very popular. All you hear about is your semaglutides and your tirzepatides, and now retatrutide, that's apparently going to be soon released. But you don't really hear about this one, and this one's good for those who don't want to inject themselves. It's an oral medication that you take daily. You can take up to 4 tablets a day, or you can get it compounded as well. When they compound it, they kind of conglomerate the dosages into 1 or 2 capsules a day, which makes it better for people who have a difficult time taking pills.